And jump into provider credentialing. So what is the standard to ensure competency among the providers before they start using POCUS? So this is based kind of on combination of American College of Emergency Physicians and also AAFP standards. And remember, those are guidelines. They are not requirements, but maybe in the future they will become requirements. And this is obviously for US-based kind of providers. So typically, it is recommended to have some kind of asynchronous learning. These days, it's usually online. There are a ton of online courses out there that you can take. Some of them even come with question bank. Some of them come with CMEs. So there's a lot to explore out there. Uh, Typically, you want to have the providers do a hands-on workshop, or if you are a provider yourself, hands-on workshop is really, I believe it's essential, although you can do simulation and remote kind of virtual training. I think it really doesn't replace a hands-on workshop where you have an expert really telling you how to do it in real time and correcting your movements as well. After that, this is the next part is the one that takes the longest, and that's the preceptorship part. And really, the minimum recommended studies that you should be obtaining is 25 of each exam type. So if you're learning a lung ultrasound, you should be obtaining educational exams, 25 exams of the lung, and then having them reviewed by an expert, someone who already knows how to use ultrasound, so they can give you feedback on the quality of your images and also on how good you are at interpreting the images. So this part where you're doing this preceptorship, say you're learning 4 different ultrasound applications, this might take actually a while. So if you're learning 4 ultrasound applications and you're getting 25 of each one of those, right? That's 100 scans that you're performing initially just to develop competency because you're getting them reviewed. And that's once again, that's kind of the current standard. It's guidelines. It's not a requirement. And then it's a good idea to have some kind of assessment, whether it comes in a form of maybe getting a certification, the way the POCUS Certification Academy has their certifications, their online quizzes. If you're part of a bigger institution and you have someone on site who is a POCUS expert, they can actually do an OSCE style type of observation of a patient of a provider performing ultrasound at the bedside. And of course, a part of the credentialing is also how are you going to maintain those credentials? Will you, when you're writing your protocols, require your providers to perform a minimum number of scans every year to maintain their skill? That's an important consideration as well. And typically, you want the recommended number is to require 10 of each exam type. So 10 of lung exams every year, 10 of soft tissue exams every year, just to maintain the skill. And another thing to consider for maintenance is would you want your providers to also have some continuous medical education? So maybe every 2 years you require 3 to 5 hours of CME specific to POCUS, or maybe it's not CME, but something that they can prove that they watched maybe content related to POCUS. And what would be the purpose of credentialing the providers? One of the biggest reasons is you just want the providers to be competent in POCUS before they start making diagnostic decisions, right? And it just goes back to patient care. You want it to be great. It also offers medical legal protection, right? So say the provider misinterpreted the ultrasound, but they have completed the proficiency, the training to basically get proficiency in POCUS that's recommended currently by medical organizations. So that could be really protective in case there is a miss. And by the way, I don't want to scare you because actually the good news, there have been studies done on medical legal risk on POCUS, and it's super minimal. Very rare to have POCUS kind of be part of a malpractice lawsuit, usually it's not doing POCUS or delaying POCUS. That's the issue. It's not about misdiagnosis. And then the next part is, although currently the payers are not required, most of them are not requiring to have a certain type of training in POCUS before you start billing. It's heading that way, or they might review or audit you, and they might ask you like, hey, we noticed that you started billing for POCUS suddenly. What's going on? Are your providers trained to do POCUS? What is their certification? So that is really a good reason, some really good reasons to credential providers and have a pathway for that.